My name is Xiaofei Li. I come from China, Peking Union Medical College, and I'm very happy to attending Prenatal Wellness Summit. And my subject is music therapy for pregnancy. Okay. This is a review and the aims and objectives. The purpose of this review was to examine the effects of music therapy on stress, anxiety, and depression in pregnant women. The value of music therapy is slowly being realized in various clinical areas. Previous studies have demonstrated a high prevalence of psychological stress during pregnancy. Few studies have examined the effects of music therapy on reducing psychological stress during pregnancy. This review provides preliminary evidence that music therapy during pregnancy provides quantifiable psychological benefits. The findings can be used to encourage pregnant women to use this cost-effective method of music to promote their daily life, and it can reduce their stress, anxiety, and depression. So let's start the introduction part. Pregnancy can be a difficult period, presenting psychological challenges for women. Many women experience considerable stress when confronted with the emotional and physical changes that occur during pregnancy. Pregnant women may experience a variety of emotions: ambivalence concerning their pregnancy, fear regarding their ability to cope with the pregnancy, and an inability to adapt to the pregnancy. Additionally, women experience anxiety over their baby's physical health and pending lifestyle changes. Stress in this context is a state in which a pregnant woman may perceive that her well-being is endangered. Therefore, a woman must devote her energy to protect herself. Anxiety, a manifestation of the stress response, is often a predominant mood during pregnancy. Anxiety is also a complex psychological process that refers to a sequence of cognitive, affective, and behavioral events. Anxiety and stress are frequently used interchangeable because anxiety is a reflection of a particular stress dimension. Also, depression is a common mental disorder that presents with depressed mood, loss of interest or pleasure, feeling of guilt or low self-worth, low energy, and poor concentration. Western studies have demonstrated that depressed episodes occur in 10% of pregnant women. The occurrence of depression during the different trimesters of pregnancy varied in different studies. Bennett found that the rate of depression during the first trimester of pregnancy was similar to that of the general female populations, whereas depression rates during the second and third trimesters or nearly double the rate in the first trimester. However, events indicated that the prevalence of depression scores measured by the EPD scale was higher during the second trimester than during the third. Anxiety and depression in pregnant women is considered a health problem similar in character to postnatal depression. Notably, antenatal psychology disturbances have been shown to affect the well-being of the mother and fetus. Several longitudinal studies demonstrated a strong correlation between antenatal and postnatal depressive symptoms. Depression can contribute to change in the neural function of newborns. Women with high antenatal anxiety or stress are likely to have premature babies as well as low birth weights. Moreover, prenatal stress is shown to affect infants' development negatively. Problems. When psychological problems arise during pregnancy, the mother must be considered in light of these risk assessments. Non-pharmacological prevention intervention for antenatal stress, anxiety, and depression should be considered of significant importance. Music has been used for healing for hundreds of years. Music, it is claimed, maintains harmony between the body and the soul and is an effective therapeutic modality within integrative medicine. Music helps patients attain an advanced state of relaxation and reduces stressful situations. In addition to altering mood, music stimulates the autonomic responses, where feelings and emotions are transmitted to the cerebral hemisphere. Furthermore, it is believed that music influenced the brain network that determines emotional experience via the limbic system. The aesthetic pleasure received by the right brain can release stress, thereby decreasing the concentration of hormone in the blood. Also, music changes the interaction of the reticular activating system (RAS) and affects emotions and autonomic function such as blood pressure, heart rate, and respiration rate. Thus, the hypothesis of this review was that music induces relaxation and decreases anxiety, stress, and depression in women during their pregnancies. And as a therapeutic tool with a standard tempo, music corresponds to a normal heart rate and produces physical effects. Similarly, soothing music with a flowing, lyrical melody, simple harmony, and easy rhythm can stimulate a relaxation response in adults and children. Researchers suppose the specific wellness advantages for music therapy applied in pregnancy and childbirth on anxiety reduction and stress, as well as providing pain management during childbirth. One small study involving 13 women listened to music with a music therapist in attendance, compared with 7 women who accepted regular hospital routine reported a significant reducing their anxiety and level of pain. Browning interviewed 11 women who participated in a music therapy exercise. All women reported that the music assisted with relaxation and distracted them from the pain. A recent study which applied music therapy to 32 women showed a significant lower anxiety and a higher level of birth satisfaction, even for high-risk pregnancies. Music therapy also demonstrated a powerful anti-stress effect. Prenatal applied medical resonance therapy music to 32 high-risk pregnancy women and showed a reduction in anxiety according to the Silberg scale. However, few studies have examined the effects of music therapy on the psychological health of normal or low-risk pregnant women. Most music therapy studies have used a small sample design, typically involving fewer than 100 study participants and lacked adequate follow-up period. So let's go to the discussion part. Pregnancy is a unique and stressful period for many expectant mothers. So this time period frequently increases stress and anxiety and results in depression. During exposure to a stressor, the entire stress regulation system is aroused. Westing, who developed a psychological framework, speculated that sensory input from music can affect the autonomic nervous system. Thereby, music therapy may be particularly beneficial for people who experience mental distress. So, we think complementary and alternative therapies are the most common choices for pregnant women attempting to avoid the side effects associated with medication. Using music therapy to decrease psychological stress during pregnancy is therefore an appropriate alternative therapy. As an effective modality, music can assist nurses in creating a healing environment that promotes physical, emotional, and spiritual well-being. Listening to music for at least 30 minutes daily reduces psychological stress, anxiety, and depression. These experimental results indicate that music therapy is an effective treatment option that promotes psychological health during pregnancy. So, experimental results also indicate that listening to music daily during pregnancy generates considerable health benefits. Music therapy is easily used in most environments. Okay. In summary, this review demonstrated that music therapy significantly reduced the intensity of stress, anxiety, and depression in pregnant women. Music therapy is a cost-effective, enjoyable, non-invasive therapy and could be useful in creating an environment that is conducive to the well-being of the pregnant woman.